It hurts. The pain is killing me. What's your problem? Recently I can't fasten the bottom of my clothes. But as it seems, you've got no problem. I've got no... Yeah. Recently the things just fall off from my hands. Thank you. Is it carpal tunnel syndrome? So let's explore this wrist and find a treatment. Let's go. Welcome back to your YouTube channel, Dr. Tajammolian. If you ever had experienced one of those three symptoms, or tingling and pain in your hand, you probably have CTS or Carpal Tunnel Syndrome. But what's that and what's the treatment? Let's figure it out. Carpal Tunnel Syndrome is because of the compression of median nerve, which is divided from the brachial plexus, as you see here, and that medial nerve travels down through our arm and goes down, as you see here, as this shiny green line, until it reaches our wrist and then enters hand and innervate the first, second, third, and half of the fourth finger. Okay? So, why is it called carpal tunnel syndrome? It's because of here. As you see, we have a tunnel-shaped thing here, which is called carpal tunnel. Why? Because carp means wrist, and it is placed in our wrist. As you see, the ceiling of this tunnel is transverse carpal ligament, and at its bottom we have the carpal bones. So whatever makes this ligament inflamed or makes a swelling here will put pressure on this nerve, and the pressure will cause a symptom in our hand. But what are the risk factors? Anything that can tighten this tunnel, like inflammation of this ligament and so on, can put pressure on this median nerve and cause the symptoms. So what are they? Let's delve into it. As you see here, all the risk factors are summarized in these pictures, and I'm going to mention all of them for you. So, ready? The first one is repetitive hand movements. Jobs or hobbies that require repetitive wrist motions, like typing on a keyboard, using a mouse, or playing musical instrument, and even gaming, can put you at higher risk, so be so careful. As you see here, the woman is typing, so this is the first risk factor. The second one is anatomy of the wrist. Some people are simply born with a smaller carpal tunnel, which put their median nerve in higher pressure than usual. The third one is age and gender. The women between 40 and 60 are more probable to CTS. As you see here, we have a young lady. Maybe you say that 60 or 40 is not young, but I have to tell you, my friend, that women at any age are always young. Okay? No more talking. Just accept it. The fifth one is health condition. Certain conditions like diabetes, as you see here, this sugar is the sign of diabetes, hypothyroidism, rheumatoid arthritis, pregnancy, we have a pregnant woman, and obesity, as you see, we have a fat woman. All of these things can put you at higher risk for CTS. But what's the reason? If you know, just type in the comment and the best comment will be pinned. Another one is work-related factors. Occupational hazards such as prolonged use of vibrating tools like jackhammer can contribute to stress on your wrist and hands and make an inflammation on the ligaments of your wrist and make the tunnel tighter, so those symptoms will just show up, okay? Another one is bad posture of your wrist while typing or doing anything else. If your wrist is in the flexed position for so long while typing or anything else, that put pressure on median nerve and causes the symptoms. And the last but not the least are injuries and trauma. Any injury or trauma to your wrist can make your wrist probable for CTS. So there's all the risk factors. Let's go for the symptoms. But what are the symptoms? As you saw at the very first beginning of the clip, the symptoms can vary according to the severity of the compression of median nerve. Like maybe it can at first start like waking up with numbness and tingling or weakness of hand that you have to shake your hand or even get it under cold water that the pain relieved. And after that, it can even happen at daytime. For example, you cannot talk with phone that much because you cannot grip the phone so properly, or you cannot hold the newspaper or book, and the more it gets chronic, Even you cannot do some fine tasks, like you cannot fasten the bottom of your clothes, you cannot zip up, or even you cannot turn the key in the lock of your door. And at last, there can be thinner muscle atrophy, as you see in the picture. So if you got these symptoms, how can you confirm that it's really CTS? You can do it by 3 different tests, which are: the first test is called fallen test. For fallen test, you have to put your hand in this position for 60 seconds. And in the 60 seconds, if you felt like tingling, numbness, or pain in any of your hand, that means the CTS is positive for you. The second test is called Tunnel test. For Tunnel test, first you have to determine the pathway of median nerve on your wrist, and after that, you just tap on it. You just tap on it, and if you feel numbness or tingling in your hand, that means it's positive. The third one is Dorkin test. Dorkin test. For Dorkin test, is somehow like Tunnel test, but instead of tapping on it, you have to put pressure on the pathway of median nerve like this. You put pressure for like 30 seconds, and after 30 seconds, if you just felt pain, numbness, or tingling, that means the test is positive. Hope CTS always be away from you. 2 simple stretching exercises and the pain of your carpal tunnel is gone at home. Are you ready? The first one, I call the slide. First, you have to do this at extension position like this, and for more efficiency, you have to gently bend your head on the opposite side like this. And even for more efficiency, you can lean your hand to the wall, which it gives more extension and more stretch on your wrist, like this. You have to do this for like 20 to 30 seconds per day for like 2 or 3 times per day. For how long? For about 4 to 6 months. Got it? The second one. The second one is like this. First, you do this. You fist strongly for 5 seconds. After that, you do this for 5 seconds. You rotate. You keep it for 5 seconds. And at last, you do this, as you see, again for 5 seconds. And even for more efficiency, you can a little pull it back like this. How does it work? It just decompresses the pressure on median nerve and it relieves the pain, okay? And it's exactly like the previous one. You have to do this for 2 or 3 times per day for like 4 to 6 months, okay? If after all of these, the pain is still your guess, it's about time to see the doctor. Thank you all guys for watching this video. Hope it was helpful for you. Don't forget to comment, like, and subscribe, and share with your friends. Love you all guys, and peace out.